Welcome to the AIM Spotlight Series. I'm Dr. Karina Testa, owner of AIM Sports Medicine and Physical Therapy in Hermosa Beach, California, and I'm the host of the AIM Spotlight Series. With us today is someone I've worked alongside for 8 years and someone that I've shared patients with and someone I deeply respect, Jay Palladino. He is a certified sports acupuncturist and he specializes in pain and sports injuries. He's the father of 3 teenagers, and he's an avid surfer and weightlifter. He is passionate about getting his patients out of pain and back to the things that they love. Welcome, Jay.
Thank you, Karina. It's so nice to get a chance to have this conversation.
I'm really excited to talk to you because we've never really sat down in a setting like this to really go over what you do and how you work with patients. So I kind of want to start with how did you even get into acupuncture all those years ago?
So, from an early age, I always wanted to be a doctor, I thought. From early teenage years, I'd had some friends whose parents were doctors, and I really kind of enjoyed talking to them and enjoyed kind of just like that every day they were like trying to help somebody. And that kind of really appealed to me. So I thought I wanted to be a medical doctor, and I was pre-med going into college. After my first year, somebody finally suggested, "Have you ever shadowed a doctor? Have
That's a
you
good
been
start.
with them through the day?" So then I was like, I never have. I just thought this was just the path I was going to go on. And then I went and shadowed some doctors I'd met in a hospital and then like clinic setting. And it didn't thrill me, but it was also running into a lot of changes I was making in my life or just things I was learning. I'd had some kind of negative experiences with traditional healthcare,
Okay.
even from a young age. And then my mom, when I was about this age, 12 or 13, when I thought about being a doctor, really got into health and started researching what food does and all these other things and how they play in our health. And that just resonated really well with me. And that was kind of what really, that's what I'm looking for. Yeah, it just got me excited and it felt deeper than kind of some of the pharmaceuticals I'd had that kind of covered up symptoms or
Yeah.
whatever. A really big thing that kind of I came to head that was really hard for me was when I was seeing a doctor for something. It was actually a dermatologist, and I asked him like, is there any foods or anything I should avoid? And he goes, "Oh, what you eat has nothing to do with your health."
Oh
And
gosh.
that just kind of obviously that was not everybody, but that just kind of
Right.
hit me deep. And then so I started seeing kind of like, oh, I don't think I want to do drugs or surgery. Not that they have their place. I don't have any issue with that. It was bumping up against my values, and it was
Mhm.
something that is not what I wanted to do all day. So I didn't know what I wanted to do for a little while. I played football in college.
Oh, nice. I did not know that.
Oh, you didn't know that? Yeah.
No.
So I ended up with a few injuries. Let me actually go back. So yeah, I ended up with a few injuries. Let's tell it from here. So I ended up with a few injuries. I had one of my work study jobs at school. My boss, her husband happened to be an acupuncturist in the area,
Oh,
and
interesting.
she's like, he's doing a little talk on acupuncture like next week. You should just go listen to him. And so I did. It was really interesting what he had to say. This kind of like holistic way of looking at the body and looking at your health, and it's coming from all these different areas, like what you feel about yourself, how much stress you're under, how much you enjoy your life, what your relationships are like. These questions had never come up to be part of like how healthy you feel. You know what I mean? It was like I always thought of it as like just like you're either okay or you're not. And some of these external, you kind of can't control why you feel good or don't feel good. It's just a luck of the draw, and
Yeah.
which we know is not the case.
Right.
So I was like, but acupuncture is weird. I was like, I don't think I can go to school to do that. That's like really weird. I was like, can I make any money doing that? And so actually my sophomore year in college, I actually got another job, and I was a student athletic trainer for the last few years of so in the off season, I helped the athlete, and I really liked the rehab portion
Hmm.
of that and kind of the hands-on part and just being kind of like you get to know people really well with what we
Yes.
do. And that was really kind of I really liked that part of it, as opposed to like just like getting the patient out in 5 minutes kind of thing that you were seeing in a regular doctor's office because they were so busy.
Correct.
And then I ended up getting injured my senior year, and the rehab and stuff I was getting was great. Also too, rehab looked a lot different then
Oh,
than
I'm
it does
sure.
now. And it was
Yeah.
like, and especially I'm from Syracuse, New York. It's not near me. So it's like the rehab that I was exposed to was like, ultrasound, hot pack. It was like the old school like PT stuff. You're like
Yeah.
hamstring stretch. It's like nothing like what's done today.
Well, it's training room rehab.
Yeah, it's training room rehab, exactly. And I ended up getting treated by that acupuncturist, and it worked really well. And I was like,
Oh,
and
interesting.
I started doing some research, and then I found that he ended up being my mentor, but I didn't know him at the time. And he was the athletic trainer at San Diego State University in the early '90s, but was also a martial artist. Got exposed to Chinese medicine, acupuncture, ended up going to school for it, and he's the one that kind of really like brought the two fields together that I
Hmm.
saw. So I was like, that's something I can get on board with. So I ended up moving to San Diego from New York.
Okay.
And that's why I
That's how
went
you
to
got to
school.
California.
That's how I got to California. And yeah, so I studied, went through the whole thing with Chinese medicine, but then with all this, always with this idea that I was going to go in this one direction of more sports and orthopedics. And what he really helped me learn was not only his systems he brought, but it was like not to be dogmatic about your education.
Yeah.
So he was bringing in lots of different fields, and that kind of let my mind open. Since then, I've taken classes with a lot of physical therapists, chiropractors, osteopaths, like a lot of different people. And then you probably have seen this too, just in our careers with the advent of the internet and everybody's starting to share information. It's
Yeah.
like a lot of treatments can look really similar, but people have a lot of
Sure.
different backgrounds because the people that are staying up with they want to stay with what's working and
Right.
what's doing the best, and that was kind of nice. So that's why I kind of am hard to pigeonhole as just an acupuncturist, because I want to bring as much in that I can cover under my scope of practice.
Right.
That'll help.
Right.
So
I love
plus it
that
keeps practice fresh and it keeps it interesting
for
and
sure.
all that stuff. So that's kind of the long story of how I got into this.
Yeah, no, very interesting, especially when you go through an injury yourself. So that
Yeah.
makes a lot of sense, a lot of
Mm-hmm.
sense. And like you said, the negative, some of the negative interactions you had with the medical field helped you decide that, hey, I want to be in it, but I want to do it a little differently.
Absolutely. Yeah, I didn't even know these other things were options. And
Yeah.
like you talked about the injury, though, which is interesting about just going to acupuncture school when I did. So we're talking 2000 is when I started. I was one of the few people in their 20s that was there,
Really?
because not a lot of people went from school. This was like a second career for a lot of, because a lot of people had serious health issues and they were like in their 30s, maybe their 40s, ended up seeking other treatment for it. And they're like, oh, I can't live my life the way I was that led to this sickness. So like they're like, I want to do this, start to help people on this path. So it was interesting.
That is interesting to be the
Yeah,
young gun, so to speak,
totally.
in the field at the time, or at
Yeah.
least in your training.
Yeah.
For sure. So,
Mm-hmm.
so tell me, so most people, when they think about acupuncture, they really do think along the Eastern medicine
Oh yeah,
idea of
absolutely. Mm-hmm.
acupuncture. Can you talk a little bit about why sports acupuncture is so different?
Let's start with just kind of the approach. Your typical exam with a typical acupuncture, somebody who practices Chinese medicine is going to tongue and pulse
Yep.
is a big thing. Are you familiar with that? So
I've had
that gives
that
us,
done. Hmm.
so a lot, a lot of Chinese medicine is like what's coming out of the body. What does it look like? Like kind of to give you a sense of what's going on internally. So the
Yeah.
tongue does that. The pulse does that. So kind of the tongue's kind of more of like usually longer standing stuff. You can see someone's maybe their constitution, kind of the directions they kind of lean towards.
Okay.
And the pulse is kind of almost like the day to day. I haven't done them in years. I don't do them, but that's where between that and like, your questions, that's the big part of a, exam. And as you know, as a physical therapist, you come in with somebody with low back pain or knee pain. If you're not actually like, how does the hip move?
Right.
How do the
Right.
muscles work? How much strength is there? So a lot of it started with just examining somebody from say Western orthopedics would,
Yeah.
just a regular ortho neuro and that kind of stuff,
Okay.
which not a lot of acupuncturists lean into. Some do, but not a lot.
Okay.
And then the needling. So a lot of the needling I do is not based on the traditional points, although some of them do overlap. A lot of the needling I do is tissue based, most of that being motor point needling. So
Okay.
the motor point, obviously, as you know, being the at the end plate there where the brain communicates with the muscle.
Okay. I'm glad you described that because not everybody understands what
I was going to
motor
make you do
motor
that.
input. Yeah.
You're like, just for everybody that doesn't know. So what happens is the acupuncture needle becomes this very specific tool to
Hmm.
talk to the inside of the body.
Okay.
So if somebody has a glute that's either inhibited or over any muscle that is either doing too much or maybe too little, or doesn't have the suppleness or the flexibility in there, because that that signal from the nervous system is like saying stay tight, or you're not getting much of a signal because the proprioception's down so much. You can take a fine needle and hit in one very specific spot and create a change through the whole muscle.
That's impressive.
So our body's being electric.
Mm-hmm.
We stick a stainless steel needle into the body. So electrically, the polarity changes at that spot. And because it's an easily excitable area that communicates with the brain then goes, whoa, what the heck is that? And we've created this novel response in the body that now is bringing red blood cells and oxygen into the tissue. The proprioception starts to increase in the area because the body's trying to figure out what happened to it, because something just came into it and did something. It doesn't seem to be creating any damage, but something happened. So we're just creating a little response there to kind of change the physiology, right, in the tissue there for a short time.
And so how does the body know with that needle whether it should be more aware of it or less aware of it?
Good question. I like to think of it as more of a reset.
Okay.
So if this is kind of very rudimentary, but it's a great way to explain this. So like, say like, your signal from your brain to your bicep is like a series of beeps, right? It's like beep, beep, beep. Then say you've been like doing yard work or something that forces that you overwork it. So now the communication is like beep, 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 beep. So the beeps are coming closer together. So it's harder for the body to discern what's happening. And or something that maybe has been injured and shut off or atrophied or not been working, the beeps are far apart, like beep, beep. So the needle has this great regulatory thing it does. So wherever you're at, that's what it does. We do have some different needle techniques of how we needle the body and in which way we can facilitate one way or the other. But for our conversation right now, the body wants to go back to homeostasis. So if it's in a pattern that it's protecting, then it's there because it feels like it needs to protect the area, protect the body, or you use it a lot or something like that. It allows us to kind of almost like reset the tissue. Okay. So then that really helps us to open up to then do our soft tissue work, to working on glide or joint range of motion, things like that. And then with all that, then now you have this area of the body that's now been lit up and it's changed. And now you can start to exercise on top of that, which is as opposed to going in cold. So that's one of the things that I like about what I do, is it kind of really gets the body to pay attention in a way that I don't think you can really, I don't know. There probably is other ways, but it gets the attention really well.
That was going to be my question. Is the only way to reset the motor point with a needle?
I don't think so. I just think it's a quick way to do it.
It's a quick way to do it.
I just think it's a quick way to do it. Yeah, I think over time, I think probably exercise is the number one thing that would be the helps create the best change and the most lasting change. This is like a shortcut to jump into that system, jump into the nervous system. And if you can decrease the pain and bring the awareness into the area, good, then the person wants to lean into that. They're okay exercising it more or something like that. Yeah.
That makes sense.
It's more of a shortcut.
Yeah, and it's almost a way to prime the body, I guess.
Oh, that's actually a better word. That's a more powerful word, is prime. Yeah, I would say that for sure.
Yeah, and the muscle is ready to do whatever the normal tasks are that you.
Yeah, you've changed the way it is for a small window. So then you try and take advantage of that during that window.
Got it. Okay. So and I know you do more than just needles when you're with your patients. What are some of the other tools once you've unlocked that you find so helpful with your patients beyond?
I love to do a lot of hands-on.
Okay.
Because palpating the tissue to find the points is great, but once you get your hands on it, you can kind of feel how the joints, the tissue's moving, what the quality is like, places where you need to concentrate. I've learned a lot of different soft tissue techniques over the years. The one I lean into most now is I've learned a lot of Rolfing. So a lot of like structural, a lot of like fascia work, the fascia and the skin glide, that kind of stuff. So the needle's not going to do that. Okay. So we're going to needle say someone's having a shoulder, we needle maybe muscles of the rotator cuff, pecs, certain things. And then we've created that, we've primed it. Now we're going to teach it to start to move in the direction maybe it doesn't want to, or free it up to move in that direction. And then you got to strengthen the new pattern, because now the body's moving differently. Yeah. It's like, sometimes it's like off the map. Like your like arm or shoulders not move this far. When you get back, you get back to the patient's like shaking. The brain's like, yeah, where is our arm? Because we thought this was this is as far back as it went, and now it's
Yeah.
back here. And
We
so
like to call that naive range of motion.
naive range, yes, I love that term. It's a good one.
Yeah,
I haven't heard that in a while, actually.
Yeah, it's a good one.
It's a good one though,
Yeah,
because you create this new space, right?
right.
But if you don't know how to use it, you're going to go back
Correct.
into the old pattern.
Correct.
Yeah.
So I know most of the sessions that, or most of the time that you spend with a patient is they're in there for a good hour. So
Yeah.
what part of that session are the needles? How long are the needles in?
The needles are about the needles are about, I usually like the retention around 8 minutes, 8 to 10
Okay.
minutes. So with me actually just placing them in, you're looking at a couple minutes, and then so maybe 15 total. I like to work antagonists too. So if I usually never do just one side of a treatment, so usually front and back, or depending on the person, like prone or lateral recumbent or something like that. And I'll want to hit the opposite, opposing muscle groups usually too as well.
Got it. So it may be 8 or 10 minutes on one area, and then
And then I'll usually do soft
minutes
tissue work to kind of get that stuff moving, because we've just needled it, so it's been primed. And then we'll usually move on to the next thing. And then probably 10 minutes or so to kind of tie it all in. I will prescribe exercise to do at home, but it's also things I want to see people do in the office too. Yeah.
Got it. So what are some of your favorite injuries or pain points that you like to treat?
Oh, it's a good question. To be honest with you, right now I'm happy with where we're at, because I used to work with a lot of chiropractors, so it was all neck and low back pain.
Yeah.
And now I like the joint. I like shoulders and knees and stuff like hips are probably my favorite thing to treat, I would think. I feel like that's a big one. It's a big linchpin in movement. We can hide a lot of a lack of range of motion in the hip that can then translate to the knee or into the back. Hips are powerful. Hips also store, I think, a lot of stuff on us too. I've had interesting emotional releases from people when you get certain things to open up.
Yeah.
And then the big toe is another one that.
The big toe. Okay, you got.
I know it's a weird one, but again, it's like another one where it's like you can tie so much back to like lack of extension through the big toe, and then that also maybe decreases your dorsiflexion, hip extension, all that kind of stuff. I love these places where you can work and create a large amount of change.
So if you're working on a big toe, are you seeing that a patient is walking better afterwards?
Oh yeah, a lot for sure. Sometimes it takes a little while because they're not used to, say, like if the toe doesn't extend that well, so they're not used to it. So then they're used to like maybe being like externally rotated and rolling through. So yeah, but once you teach them to start to move over the big toe and they start to trust it, yeah, absolutely.
Well, I can work all the way back up the chain then.
Totally, yeah.
Oh, that's so interesting, because my next question was going to be, what's something people would be surprised to know that acupuncture can help? And I'm just got surprised by the big toe, but is there another good one like that?
Orthopedically, let's see. It would probably be the suboccipitals.
Okay, which
huge
for those people are right at the
the base of the skull.
Head, the base of your skull.
I mean, they have like 30 times more mechanoreceptors in them than most of our other muscles.
Wow.
Working them with the hands is great, but again, they're tightly packed in there. And a needle, we can get right down to the occiput basically and get all through that tissue. And it really frees things up for people a lot. Everything from neck rotation and extension to just muscle tension headaches, fogginess even in their head, things like that.
Oh, wow. So mental clarity even.
Yeah, for sure.
Oh, I like that.
Yeah.
I like that.
So those are powerful points. And then some of the more, when I bring in some more of the traditional Chinese stuff where we're just doing some few points to kind of just calm the nervous system down, people really respond well to those too. Okay. And obviously, as you know, it's like it's much easier to treat somebody when they're nervous, or their nervous system is relaxed.
Yeah, when you're not fighting that aspect of them that they can't even really control.
Absolutely. So but probably if I was going to really answer the question super honestly, the best thing I love to do is not actually a particular part of the body, but it's like if I get to know somebody enough and I start to focus my questioning beyond the injury and talk to them about their life, where they're at in their life. Kind of go back to what I talked to in the beginning, was like people don't realize like how connected these injuries can be to what they're experiencing in their life and their relationships and things like that. So, I mean, I know you've probably seen it, like somebody comes in and they're all antalgic, crooked, back's killing them. Like, what happened? And they'll be like, oh, I picked up a sock off the floor or something. And you're like, so obviously that's not the insult that created it. But then you ask questions like, oh, I got divorced 5 months ago. We had a death in the family. I lost my job, things like that.
Yeah.
And they don't, when I can make that connection with like how important, your relationship is to yourself, everybody else, even what's driving you. What's driving you to get up in the morning, things like that. Are you living your own life? Are you living a life that somebody else wanted you to live? Or are you living a life just so you can keep up financially? All these things, people start to make these connections about how much pain they've been, injuries, and like these different things in their life. So when that light bulb goes off, that's probably my favorite thing. And that's what I will dive into a lot.
So you're finding that that type of that stuff manifests into their bodies, into their muscles. Does it manifest differently on everybody, or do you see some?
Oh yeah, no. I think well, there's definitely some similarities, and I think it'll also manifest sometimes into where they've had a previous injury, or a weakness, or something like that. I'm not sure 100%, but that's the patterns I've seen. A lot of it's just kind of meeting people where they're at, and it can look a lot different. But think about what a lot of people do repetitively. So would be at their desk. So pain starts up at their desk, project they don't want to work on, or their bosses, these things. And then the neck and the wrist pain. And they're obviously doing repetitive stuff, but it's with that also on top of it. So that would be, I'm trying to think of some other good examples, but that's where the big one was. Yeah, I've had a few Bell's palsy cases, people after divorces or deaths in the family, which were interesting.
The whole side of the face not working.
Yeah.
That's interesting.
Yeah. So it's fun. People need to know how powerful they are.
True.
And their day-to-day interactions really reflect in kind of their energy in the body and stuff like that.
So as you know, I'm a person that is nervous about needles, and particularly some of those longer needles that you use for some of those deeper muscles. What do you say to someone that wants to get your care but feels nervous about the needles?
Oh, that's a really good question. And I meet everybody where they're at.
Okay.
But I had a great story. This happened yesterday.
Okay.
There was a guy who got referred by somebody, and he wanted to bring his 13-year-old son in because he has an ankle injury. And then we're texting, and then we make the appointment. He comes in, but my gut was saying, I don't know if he knows I'm an acupuncturist.
Dad's springing this on him.
So they got here, and they started filling out the paperwork, and they saw that was the title, and they're like, oh, I don't know if we're going to stay here. And 13-year-old kids do not want to get needled.
No.
I actually have an interesting point on that. I'll put it aside in it, but I'll just continue on the story. So I was like, hey, I just did an exam to see where he was at. It was just a simple inversion sprain that he's also got some other stuff going on in his foot. I think that's compounded it. And so I told the dad, I was like, you guys can leave. I'll just do an exam on him. Like, you can see a physical therapist here. They're going to be able to take care of him just as good as I am. But he had acupuncture for a lot of stuff. The dad did. So he's like, maybe you should just try. So I have a 13-year-old kid, and I'm trying to explain to him, because the hardest part is to explain what it feels like. And so my spiel always is like, the needle you're used to getting a shot from is hollow, and that punches a hole in your skin, so fluid's going around. So that's what he knows. He thought he was going to get like 12 injections.
12 shots.
So the needle's only as wide as a strand of hair, and it's solid, so it does very little tissue damage. It's rare that I get a drop of blood. It's even rarer I get a bruise. It does happen. But I've needled people on blood thinners and not gotten bruises.
Okay.
So I tell them, you're not really feeling the needle go through the skin, but when we get into the tissue we're targeting, you're going to feel a little pressure, a little achiness, a little bit of warmth, and sometimes the muscle will fasciculate too. And that's that response going on in the body that I explained earlier. And I go, the most common response I get when I put a needle in someone for the first time is, oh, that's it. So
I love that. That's it.
There's this, he's like 6'3" or 6'4", this 13-year-old kid, just a big kid. And he's laying on the table, and he's like, Dad, hold my head. His dad's like, oh. And then I had him take a deep breath. I popped the needle in, and he's like, are you going to do it yet? And I was like, dude, it's already done. And he looked up, and he's like, oh.
Wow.
And I was like, well, that's kind of all there is to it. There are some that are stronger. I always meet people that when I first needle somebody, I don't needle them aggressively. If they're very hesitant about being needled, I will dial it back. If there's something I feel like we need to push it a little bit, I will have a conversation with somebody.
Okay.
But I usually have to know if there's that trust there, because it doesn't have to be super hard for everybody. It doesn't have to be very easy. It kind of some people want a stronger treatment. Some people need a lighter one. So we just try and, I've been doing this a while. So I've really been able to kind of dial in to kind of help people with that fear on needles.
I
Yeah.
like that. I like that.
Hmm.
Well, so here's a question. So in the PT world, patients usually see us for a prescribed amount of time and a couple of times a week or whatever we feel is going to be the most appropriate. Is it the same in with acupuncture? Is
Totally.
it the
Yeah.
same? Okay.
Hmm. My
Okay.
favorite schedule when somebody starts is be like, I like twice a week, usually for most things, for 2 weeks. So like get 4 visits in, maybe a fifth one, depending on how long it's been there.
Hmm.
And 90 something percent of the time I work on somebody, if we're going to make a change within those first few visits, where it's like 20-30% different.
Okay.
And then that way I have a good idea of like how much more treatment somebody's going to need after that. So I usually, as opposed to you guys would get a script for like, somebody post surgery, they're going to need a certain amount. But I work with a
Right.
lot of chronic things that people
Hmm.
just, the things that people are like, my elbow hurts. I'm like, what happened? They're like, nothing. Just start. You know what I mean? It just started. Like a lot of those things. That's what I treat. So sometimes they go quick. Sometimes they take longer. But usually within the first few visits, I'll know how successful I'll be,
Okay.
because we'll start getting responses.
And so what would you say are some things that you actually don't treat that other acupuncturists might?
Oh, I don't do any like internal type. So a lot of acupuncturists they're generalists too. They do a lot.
Okay.
They kind of treat everything, because Chinese medicine is a beautiful, elegant medicine. It's like everything non-emergency that works
Hmm.
really well. So a lot of my colleagues, they treat digestive issues, reproductive issues, women's issues, either like around their cycle, perimenopause, menopause. Even some people do pediatrics, so
Hmm.
that's kind of interesting when they do that.
Yeah.
So kind of like anything you can imagine, they treat. Yeah.
So
So
you're just really concentrated more on true sports injuries,
yeah.
muscle injuries,
Hmm.
that kind of thing. So
And
we're
I'll only bring in some of the other stuff if I'm
uh-huh.
like, man, this person's like they've just been burning the candle at both ends. So we'll try and do some stuff to kind of help support their system while we're trying to work on that kind of thing too.
Love that. Okay,
Yeah.
great. Well, thank you, Jay. That was so enlightening. I learned so much about just how the needles work and why they're so effective. I know when your patients come out, they're always smiling and they're always raving about their
I bribe them
effectiveness.
to do that as they leave. I'm like, you guys got to make me look good, please.
But I really appreciate you talking to me today.
I know, it's super fun.
Yeah, this was really good. So thank you.
Awesome. Thanks, Karina.